Whilst many of us, of course, enjoy the summertime, for 26% of adults and 10 to 15% of children, summertime isn't always the most fun, and that's because they suffer with hay fever. Allergic rhinitis, also known as hay fever, is an allergy to pollen. It can start as early in the year as March and end as late as September, depending on which pollen you're allergic to. Most people are allergic to grass pollen, which is most prevalent between mid-May and July, but you can also be allergic to tree pollen or weed pollen. The most common symptoms are runny or congested nose, tickly throat, itchy eyes, which can also water, headaches, and sneezing. Now, it's generally considered to be a fairly benign condition, but it can really affect people's quality of life, their work productivity, their sleep patterns, their will and want to socialise, and we've even got evidence to show that children can drop a grade as a result of hay fever. Hay fever can affect anyone at any age, but it most commonly starts during young adulthood or adolescence. We don't know why it begins, but there is likely to be a genetic link. There's no cure for hay fever, but there are a number of things you can do that are considered self-help measures. So firstly, it's avoid going out when the pollen counts are high, and that's often during the morning and early evenings. I'd keep all your windows and doors shut where possible, and if there is any pollen in the house, getting a damp cloth and dusting your surfaces to try and remove that pollen will help, as will regularly vacuuming. Some people also invest in an air purifier to try and trap those pollen particles. If you do have to go outside, I suggest wearing wraparound sunglasses so the pollen can't enter your eyes, and also popping some petroleum jelly around the nostrils to trap any particles trying to enter the nose. Also, when you return back into the house, take off your clothes, pop them in the wash, and go and have a shower to wash off that pollen. Do make sure that any laundry you have isn't then hung up outside. Also, if you have any pets, it may be wise to try and keep them indoors during those high pollen counts. But if that's not possible, again, when they return back into the house, use a damp cloth to stroke them and therefore remove that pollen. In terms of medication, there are a number of treatments you can get over the counter. The most commonly used medication is antihistamines. But often antihistamines alone won't suffice, and people usually need to use a combination of medications, including eye drops and nasal sprays. Antihistamines can take a couple of days to kick in, so it is important that you do take them daily. The nasal steroids can actually take 2 to 3 weeks to kick in, and so you actually need to start them before you even get symptoms. Now, this obviously takes a little bit of forward planning, but do have a look at the Met Office, which can give you a forecast on the pollen counts. For people with particularly resistant and hard to treat hay fever, the next step may be immunotherapy, and that's where you are given small amounts of the pollen you're allergic to in incremental doses so that your body and its immune system can slowly get used to it and therefore not react quite as floridly when the pollen kicks in. However, immunotherapy does need to be started around 3 months prior to the onset of the hay fever season. There are also complementary therapies and alternative therapies out there, and the use of local honey and bee pollen are often suggested. Now, the clinical evidence for these is somewhat limited, and you may say, I might as well give it a try because they sound fairly harmless. However, it is important to know that there is a concern that bee pollen contains a very high concentration of pollen, and so for those that are particularly susceptible, it could trigger off an anaphylaxis.